The number one thing that somebody wants when they come for healthcare is care, right? Somebody wants healthcare, but it's much more involved than that. And obviously, we know that there's many processes in place. There's a lot of education that's needed for staff to be able to adequately and appropriately administer that care that is needed. But what is that one thing that is really, really important? And we have often gotten so busy with so many different things that we've forgotten that important thing. And I'm going to tell you exactly what that is in just a moment. But first of all, think about what you as a medical care provider, a nurse, a physical therapist, a physician has to do to appropriately care for an individual. And a lot of the time, the initial thing that we think of is we have to be really educated, we have to be well trained, we have to be able to perform certain technical tasks. And all of those things are true. However, let's take a few examples. You may be working in a critical care environment and you may have a patient on the ventilator. They have multiple drips that have to be adjusted, their weight-based dosing, their micrograms per kilogram per minute, and you have to make a lot of small adjustments. You have to watch their urine output, you have to watch their hemodynamics. There's a lot of different nuances of care that are very important and very technical. And all of those things are certainly required, and I'm not in any way trying to downplay any of that. It's important. You, in whatever your role is, you should do the best job that you can, and you should absolutely take it very, very seriously. But what I'm really talking about is not what you want and not what you need, but again, what does a patient want when they come into a healthcare facility? And that answer is care. And the care that's provided is often reflected through the main thing that they're seeking, and that is compassionate interaction. Patients, when they come into a facility, they want a compassionate care provider. I promise that titrating those drips is important, but most of the time what they're going to remember is that you gave them a pillow, or that you gave them a warm blanket, or that you sat down and had a conversation with them, or you had a smile on your face, or a positive attitude. And those are things that do not take any kind of education. They don't take any kind of learning. And so complementing the education that you've received, all of the classes that you've been to, the certifications you've obtained, all of those things are very important. But at the end of the day, that's not what the patient looks towards. What they look to is the way that you interact with them, the way that you care for them, the way that you advocate for them. And all of that comes down to that patient-caregiver relationship, or the client-caregiver relationship, as some may also call it. So it's really, really important that as you're educated, as you collaborate more, as your profession grows, as you interact with more people or take certain positions, that you never lose sight of what the ultimate reason is for individuals seeking care. And that is that there's appropriate care provided. Now, of course, you could go into a surgical area and you want to make sure that technically the rotator cuff is repaired appropriately, or technically that the CT scan is performed correctly and that you don't have to have another IV and more contrast because the IV blew. There's certainly, again, many things that technically are very, very important. But it's always, always a good thing to remember that the important part of healthcare is care. And the care comes from collaboration and communication. So if you need to seek a goal for 2024, if you're looking for some way to change your practice, make minor changes in the way you interact with individuals. Take an extra minute with them. Sit down and ask them how their day is going. Ask them about a family member. Ask them about a hobby, a pet, anything to make some kind of connection with them. I promise you'll start to see major results just from focusing on that one tiny little non-technical thing that doesn't require any courses, education, or classes. It just requires a human interaction, and that's what people desperately need when they're in a healthcare environment.